How are you?
Good, how are you?
Good morning.
Good. Thank you.
Oh, he's there.
One, two, three, 4, 5, 6, 7, 8, 9, 10. Morning, Heather.
Good morning.
Thank you, as always. So, here this week, we've been busy as ever, still running our 24/7 response to the COVID-19 pandemic. I've been incredibly proud of our Army of Public Health Warriors here working in concert with Governor DeWine and Dr. Acton around the clock on response. I think it's been incredible to watch public health that's often invisible now. In the past, people didn't recognize the work of prevention, and I think it's front and center now, and I'm really proud to see the work that's happening to reduce risk in our community, to reduce fatalities in our community. I'm going to ask Kevin Brennan, our communications officer, to bring a picture up. I mentioned last week to you that Kim Shepard, who's a longtime employee of ours, she made a sign for her father who's in assisted living, and he's a big Cleveland Indians fan. And so Kim made the sign and is going to put it up on her dad's window. Encouragement that hang in there and know that there may still be an opportunity to see some Cleveland Indians baseball, and being a big fan. And so we appreciate Kim's diligence and her support for her parents. Lots of stories like this and around the country, and certainly in Cleveland, of people putting signs on their parents' window, and we appreciate that uplifting message and also Kim's ever-present smile. So lots is happening, and I think my message this morning is, in this new normal, it is not one thing that's making a difference in Ohio, and we are making a difference here in Cleveland, greater Cleveland, and in Ohio. It's a number of things working in concert together. So we know that we've been pushing hand washing from the beginning, and surface cleaning, and social distancing. We know that gatherings and closure of schools and businesses that are non-essential closing, and remote work occurring. People who are sick that are staying home. It is a combination of all these things, a confluence of all these activities that are working together, along with the contact tracing, quarantining of people who have been exposed to sick folks, and isolating people who are sick. It's a combination of all these things. The telehealth activities happening through our medical systems, and the timing at which these things began is having a big impact here in Ohio, and is saving lives here in greater Cleveland. Saving lives. And so I think we should reflect on that as we go forward. I think our leadership at the state was essential in getting us there. So we think we need to continue to stay on this course. We know that we're watching the numbers. We're watching the rate at which new cases are being reported. And there's some encouragement, certainly again, from the West Coast and here in Ohio, that we're making a difference. We're in for a big couple weeks, we believe, in Ohio and around the country. And so we're going to continue to redouble our efforts for response. And you'll know that we're committed to do that. So as a reminder here, we've noticed out in the community that people are adapting to the social distancing guidance, and they're taking it to heart, particularly in places like grocery stores and in large big box stores that are providing food and other resources. we're starting to see that people are beginning to follow the guidelines. They recognize that they're part of the solution, part of the prevention picture, and that's nice to see. There are these, like Kim Shepard's sign for her dad, there are countless examples of kindness, of people reaching out to neighbors and friends in the community to try and ease the burden of the response, and we are grateful for that. And I'm reminded again of Senator Sherrod Brown, who said his daughter told him that we shouldn't act like someone else has COVID-19 and we need to stay away from them. We should act like we have it, and we need to protect them from us. And I think that's the mindset that we need to take going forward. So keep reaching out to your friends and neighbors. As we move through this, the challenges grow, particularly the most fragile people in society, those that are invisible or ignored. The challenges grow for them week by week, day by day, and we need to be vigilant. I mentioned last week that the foundations have stepped up to serve folks who have challenges, often people of color, people who are low-wage workers, or people who count on the network of social services that is now disrupted in the context of this response. And now is the time where Cleveland needs to be there, as we always have, for folks who need us the most. There's a number of new brief videos that have been put together on our website, and working very closely with our partners at Cuyahoga County. I'm again very grateful to County Executive Armin Budish for his support, videos and some guidance for the public. Dr. Gullett has put together a number of videos, training videos that we know have been useful to other counties in Ohio and other places around the response framework that is in place here in Cuyahoga County, and we're very grateful to Jonathan, Chad, Jeff, and Scott for the excellent work that they've been doing to support us. We appreciate that through the Cuyahoga County's support for our efforts in response around getting the word out to the public. We're now on YouTube and have been at CCBH.net with a whole range of information around the briefings, interviews we share with that Dr. Fauci has done, and tips in many languages. There's actually a website now that is put together by Case Western medical students and Harvard medical students that has COVID-19 information in 35 languages. 35 languages, if we've linked to that site for people to learn about the issues and the challenges. So we're going to talk a little bit about masks today in a little bit. So you know that the CDC has made a recommendation, and Governor DeWine a recommendation, that when people are out in the general public, they consider wearing cloth masks, something you can make at home. Dr. Adams, the Surgeon General, has a great video of a cloth mask he made out of a t-shirt and a pair of rubber bands. So it can be done at home. We've seen many of these videos on YouTube. So the idea of a mask is to protect you from other people, to protect you from other folks, and not the other way around. And these masks could be cleaned, washed, certainly, like any other t-shirt. So these sort of things could be implemented and should be implemented in public, particularly as we are here in a very critical time here in Ohio. So we want people to think about those things. We want you to check out our YouTube site. Continue to go to the Ohio Department of Health's website, coronavirus.ohio.gov, and also ccbh.net for information. So we're going to continue to stay committed. We're, like everyone, is tired, and we are committed. We're committed to continue the pace and the response that we have built here in Cuyahoga County and in Ohio. I think that we know that this is the right approach. I think people have a sense that this is the way that we should be doing business, and I'm grateful to be part of it. With that, I'd like to invite Dr. Gullett to provide some comments, and again, as always, thank her for her commitment to the work we're doing.
Good morning. Thank you all for again being here and continuing to cover so many dimensions of this crisis response for COVID-19 here locally in Cuyahoga County and the greater Northeast Ohio area. We're very appreciative of your continued support from a media perspective. I'd like to start today by thanking a group of people who often go relatively unnoticed at our healthcare facilities, but without whom none of us could provide any level of clinical care. There is truly a remarkable team of people at every hospital, long-term care, skilled facility, other community healthcare providers without which we couldn't ever do any kind of direct clinical care. Those are the people who keep the buildings going, keep everything in order, keep rooms and facilities cleaned, keep everyone fed, including the people who are residents of those facilities or patients at those facilities, as well as the staff working long hours. There are countless teammates in the clinical world who are behind the scenes, and those are the people who we really want to highlight today. Those are the people who I think we need to continue to recognize are getting up every day, putting their families at risk, putting themselves at risk to make sure that our hospitals and healthcare systems continue to be able to provide the high quality care our region is known for in the midst of a surge from COVID-19. So we see you, we appreciate you, and we remain determined and stand with you as well. We want to protect you, we want to make sure you have the resources you need, personal protective equipment and otherwise, to continue to do your jobs well and safely. And I just wanted to make sure we call out how grateful we are for your commitment to our community and the sacrifices that each of you are making. I wish I could stand up here and list the thousands of individual names of those people, but please know that you are appreciated and we are very, very grateful for your work. I'd also like to remind all of the viewers that the information I'm about to share represents every single person affected by this, whether it's an infection yourself or a family member or a friend, or whether you've lost a loved one to COVID-19. Please know that every single one of these people is an invaluable member of our community, and we stand with you through this. This is going to be a while before we recover back to where we know life probably never exactly the same as we did, maybe for good things we'll hold on to after the end of this, but please know that these aren't just numbers, these are people, and these are really, really important members of our community. So please continue to support them and continue to respect their privacy in every way possible. The number of lab-confirmed cases for the CCBH or Cuyahoga County jurisdiction, excluding the city of Cleveland this morning, is 574. The age range for these cases is 1 week of age to 101 years of age. The range of illness onset is February 29th to March 31st. We have had 15 deaths to date in our jurisdiction. The age ranges of 63 to 91 years of age, and the dates of death range from March 20th to April 5th. Every single time death is called to our team, we pause and we just take a moment to remember those families. So I hope that you too will continue to think about the human toll that this virus is taking in our community, and remember that we are in this together and we need to support those families. This is really hard for everybody, but it's going to take all of us really caring deeply for each of these affected families. I'd like to just revisit masks for a moment. Masks are not a substitute for social distancing. Let me repeat, masks are not a substitute for social distancing. We need you to do social distancing everywhere you are. At work, if you're an essential employee and an essential business, at home with your family members. If you are out in the community and you're coming home to your family members, please use social distancing. It's really hard. I want to hug my kids. I want to be close to them physically right now, but I'm out in the community and I may be the person who brings it home to the family. So you need to remember that social distancing, even your own home, is important. You've heard the Centers for Disease Control, Dr. Adams, our Surgeon General, Dr. Acton, our Director of Health in Ohio, and our Governor talk about voluntary recommendations to cover your mouth with cloth when you're out in the community. I would like to echo that as a recommendation that, again, is not in place of social distancing, but will ensure that we can actually protect each other on yet another level. It's important that we think about the fact that we could be the person with the virus who doesn't have symptoms yet, and we're spreading it to other people. So we're doing our best to cover ourselves and to maintain the social distancing. 2 different ways to prevent transmission. But again, others around us may have it too. So it's a two-way protection, and we need you to do that. But I would ask that you please use cloth and not take surgical masks or N95s, because those need to be used in the highest risk areas. We have people working in intensive care units and emergency departments who are taking care of high volumes of people who are positive with COVID-19, and that's where our personal protective equipment, medical grade, needs to be. So I would ask that you please use cloth. That's what I used when I had to get groceries this weekend. I have cloth, covered my face. I'm not going to take a mask that I know my colleagues need in the front clinical care lines, okay? So I would say if you could please consider, if you have surgical masks or you have N95 masks at home, in your garage, other places, please consider getting yourself a cloth covering, making one with a t-shirt and rubber bands like Dr. Adams showed on his video, or purchasing them from friends who are great at sewing, or whatever pathway you can find. Please consider taking those medical grade equipment, those N95s, those surgical masks, and donating them to your county emergency operations center so that they can be swiftly distributed to our healthcare providers who need them most. If you're in Cuyahoga County, you can reach the Cuyahoga County Emergency Operations Center for drop-offs between 9:30 a.m. and 2:30 p.m. Monday through Friday. And that location is at 2501 Harvard Avenue in Newburgh Heights. So I would just encourage you to please consider those donations. Even a donation of 1 or 2 masks is important, and we would gladly accept it and distribute it where it is needed most. I'd like to just finish with a few updates from Governor DeWine's press conference on Saturday. He signed an order which allowed increased access for telehealth services from counselors, social workers, and therapists. Behavioral health is a critically important part of maintaining health in a pandemic and in regular life outside of a pandemic. I feel very strongly that we need to ensure everyone has access to behavioral health services through this time and once this is over as well. So the rapid developments in telehealth for medical care and for behavioral health care, which are truly need to be integrated in our community in new and exciting ways, really is going to increase accessibility for everyone. And so this is very exciting for me as a primary care and public health physician to ensure everyone has access to the behavioral health care they need. Usually in telehealth for behavioral health, you may have to have an in-person visit face-to-face at first, and there are additional trainings that are necessary for behavioral health professionals in implementing telehealth, but the governor's order clearly allows some of those requirements to be fast-tracked. And so I just want to make the public aware that we really want you to work closely with behavioral health providers in your community, in your county, in your region, to make sure you personally access those services or others around you also access those services. We are not powerless in this crisis. I heard an excellent interview with a psychiatrist this weekend talking about this issue. We each have agency, we each have a role in this as individuals and as community members. We're intimately connected with one another. And a pandemic or a crisis like this helps us see that even more clearly. And behavioral health is an important piece of this. So we want you to feel that you can take control of any of that anxiety or stress that you're feeling, and know that that is natural and there are resources available. If you're experiencing stress or anxiety, you can call the Cuyahoga County 24-hour warm line at 440-886-5950 to talk with a peer. You can also text 4HOPE, the number 4, HOPE, to 741-741, which is the crisis text line. And if you're in crisis, please call the 24-hour suicide prevention hotline, mental health and addiction crisis information and referral hotline at 216-623-6888. These resources are here for every single one of us in the community. Finally, I'd like to close with a quote. This is by someone named Sasha Dichter. And I ran across it this weekend, and I just thought it was important to share this morning. You've heard Dr. Adams, you've heard others talk about upcoming difficult weeks, and this may be our week here. It may be an upcoming week a few from now. But either way, this is getting harder as the human toll continues to rise. So I hope you'll take these words with you on this bright Monday morning with sunshine and spring coming, and live it out this week and beyond. The quote is, "Today, give yourself permission to be outrageously kind, irrationally warm, and improbably generous." With that, we'll take some questions.
You had mentioned of the new infections in suburban Cuyahoga County, you've got a 1-week old. Based on how long it takes for symptoms to show and the timelines we're talking about here, does this mean babies are being born with coronavirus?
Yeah, so the question is, given that we now, our age range includes newborns under 30 days of age, does this mean that people are being born with it or that they're being exposed? How does that happen? So we actually are working closely with the obstetrics care providers here in the community on a research study to better understand how transmission and protection occurs in the obstetrics and the maternity care timeline. But we do know that transmission happens within 2 to 14 days of exposure. And so within 2 days of being exposed, we could have a positive. And so with a newborn, they can be exposed with their family if the family's positive or wherever they're at, which is why we always try to keep newborns in. But when a family is trying to isolate with a child, it's really hard. We've had minors, since the very beginning, we've had minors under the age of 18 who are positive in our community. And so that's a special vulnerable population, and we just really need to focus on preventing transmission to protect those who are most vulnerable, which includes our children.
It's either for Dr. Gull or Director Allen. I know the director had mentioned that there was some positive news coming out of the West Coast and coming out of Cleveland. Specifically, what is that? What sort of, is there a flattening or just basically give me some of the science behind what you guys are seeing?
So the question is, we referenced, Health Commissioner Terry Allen referenced earlier in his remarks some positive signs, glimmers of hope, and what are those specifically? So I will answer one or two and then ask Commissioner Allen to answer as well. So one of the ones that I've seen is a map that was published by one of our national media outlets around looking at whether people in certain areas of the country were staying home, and we are really rocking it here in the Midwest and particularly in Northeast Ohio. If you look at that map, we are staying home, and that's coupled with some information that we were able to obtain from Google, and we will share more widely on Wednesday actually, but one of our supervisors in our epidemiology, surveillance, and informatics divisions sent this to us late last night, that here in Cuyahoga County, we are showing that people are staying home, and there's objective data to show that people are staying at home and that they are not driving as much, and that they are not at work as much in the workplace. They are probably working at home. We can't really measure that so much. Maybe if we knew how much technology was being used to do social distancing and remote work, we could see. The one place we don't see any decrease was in park utilization. We saw a lot of increase in the outdoor usage, and that's okay as long as social distancing happens. And in some parts of our parks, that didn't happen this weekend. And so we need to make sure that even though you're enjoying the great outdoors, make sure you do it at a distance from those around you. But those are some of the bright spots we're seeing. On the clinical side, we're still trying to understand how places who are hit a little harder than us or a little ahead of us are coping. There's still a lot of issues with supply chain, meaning the supplies coming in are not coming in, or they're held up, or they're way behind in creating new products. And then with regard to ventilators, you see places that are governors, 3 states this morning talking about their surge and their need for ventilators. So on the clinical side, I think we still have a long way to go nationally, but locally we're really trying to do our very best. But those other things about people heeding the warnings and actually doing what each of us is empowered to do here is very encouraging to me. I'm sure Terry probably has other things to add.
Thanks.
So I think the main thing for me is Dr. Gull and I were sharing exchange from Surgeon General Jerome Adams, Dr. Adams. And he was talking about use of cloth masks nationally. And he quoted Dr. Acton in the story. And I thought it was pretty cool. She said that, she described that, on the front end of a pandemic, the people's calls for discretion around limiting movement, around closure of schools, and Ohio was a leader. Ohio has been a leader and continues to be a leader. In other states, if you watch, there's a cascade of states that follow Ohio on the announcements, using data to drive decision-making based on past pandemics, and data has been central to the decisions in Ohio. And so the quote goes on to say that on the front end, those that are making those decisions up front look like Chicken Little. The sky is falling. And I think, frankly, on the back end, they look like prophets in terms of preventing cases and fatalities. And we know that there's a lot of heartbreak in this story, but the level and intensity of what's happening in different places in the country will be determined, and the story will be told by those that stepped up to use tried and true public health measures to prevent transmission. And that is the story for Ohio, and that is a glimmer that I think drives all of us, colleagues on statewide calls here in Ohio. That sort of leadership in tough times is something that has defined Ohio, and I think it will define our response at the end of the day. And so that's what gives me hope and encouragement.
Can you share any information about the demographics of the people who have been confirmed with cases?
The question is about sharing additional demographics of the people who've been confirmed with cases. So as I've mentioned previously, we want to share as much information as we can about demographics, but privacy is always a balance. And so we are looking at analyses of those data for the CCBH jurisdiction, but we have to always balance that with releasing demographics when there's enough that there isn't identifiable information. So we're getting to a place where we probably are going to be able to do that very soon because we have so many cases. With the deaths, that still is an issue because we have very few deaths, although 15 is 15 too many. We still know that will continue to rise, unfortunately, most likely given the number of cases we have. But we're doing our best to try to minimize any future loss of life here. So that is not something that we're ignoring at all. It's actually been something from the very beginning. Those of you who follow our work and know our work prior to the pandemic know how important equity is for us and as a team here at the Cuyahoga County Board of Health. Equity drives everything we do, and that's the opportunity for everyone to have their full potential, regardless of race or ethnicity, language, sexual orientation, or other demographic. And so for us, this is no different than that, but we do want to balance privacy, and so we will continue to share that as we are able. I also want to say that the lack of testing also makes that very difficult because there are certain populations of our community that have not been able to access testing. So while I can give you data about lab-confirmed cases, it doesn't necessarily represent everyone in our community who hasn't been able to access testing, even if they're symptomatic. So that's a caveat that I wish everyone to consider. I will continue to remind everyone how important testing is, and I won't stop until we get more testing. I don't know where it's going to come from or who's going to pay for it. But I'm going to continue to push because that's crippling us, and that's what's going to get us to where we need to be to get this curve flattened and get our community and our economy going again.
One more question.
There's been a lot of ominous talk, especially out of Washington, about what to expect this next week. What are you guys expecting here locally, and are we ready for what could come in the next 7 to 10 days here locally?
So Scott's question is that there's a lot of, and I'll quote, ominous talk about at the federal level about this week and about what is expected this week with regard to fatalities and other surge issues around the hospital. I do my best in the midst of trying to do case interviews and contact tracing to follow what the national media are saying so that I can understand how to translate those messages to what it means for us at the local level. So I am aware of some of what's been said. I'm also aware of Dr. Adams' comments. I watched a few videos, so I understood what he was sharing before today's press conference. I think when you look at the federal comments, they're looking at our community as a nation rather than any one particular locale. And that's why we continue to have these regular press briefings with all of you so that you understand how to interpret what you're hearing at the federal level and the state level with what's happening on the ground here in Northeast Ohio. And I will tell you that we have a very robust public health response here, and we have a real commitment, not that everybody does, but we have a lot of resources here in public health with regard to people. We don't have financial resources. We have a lot of volunteers helping us, but we have a lot of people committed throwing their public health expertise behind this response. And what that has done has allowed us to really get ahead of case identification and contact tracing. And as I continue to talk to you on Fridays, we're really trying to do everything we can to manage people in place when it's safe to do so that our hospitals are not overwhelmed with people who don't need to be there, but they're able to care for the sickest folks. And so I know that this and next week and the subsequent weeks are going to be hard, but I don't necessarily know that this is that week for us here, because we have really been working hard over the last month to make sure that we stay as far ahead as we can. Other places certainly have higher density of population. They have different housing than we do. They have different public health resources and hospital resources than we do. So those are all the things we have to take into account here locally. And the other thing I'll say is that we here locally take care of a lot of people in our tertiary and quaternary care centers, our hospitals, from other parts of the state, because we have such big hospitals with such high levels of care that can be provided. And so the other thing I'll say is when we think about our local situation, we also have to think about, as the cases spread in Ohio, we've had a lot of cases here earlier, we had a lot of extra testing, but as we get more sicker people in other parts of Northeast Ohio, they will be coming here for care when they need ICU and bigger and more intense levels of care that maybe their hospitals don't have as much bed capacity, et cetera. So that's another variable that we are very closely watching, but not one that I have any predictive model to share with you around it's going to be this week or next. We know that the cases are growing in Ohio, and so the coming weeks are going to be challenging for all of us in that regard.
As we wrap up, I forgot my brother Pat. I was thinking about him on the way, and he works for a national courier service. And so he told me when I talked with him recently that it's been like Christmas in terms of their volume the last few weeks. They're hustling, long hours, interacting with folks and delivering critical goods and services to people with many of the other retail stores being closed. I just want to say thanks to all those folks that are working hard to assure that those packages get delivered quickly to people that need them. And I know that their Christmas sort of push that they're making now is extended, and I know he comes home tired every day, and many of them do. So I just want to thank them for that service, and we look forward. Thank you all for being here. Remind your neighbors and your friends that what we're doing right now is working. The things we continue to do are working, and they are part of this network, this solution, and a network of people saving lives here in Cuyahoga County and in Ohio. And so with that, we look forward to seeing all of you on Wednesday. We thank you for being here with us during these briefings and for your dedication, all of our journalists and media members, your dedication to making sure that the messages get out to the public. We appreciate it. And you do have a faint smell of bleach in here. Our cleaning folks have been diligent to assure that the surfaces you're touching are thoroughly clean, and we thank them very much for that. Our folks that are here throughout the day keeping our place spick and span. Thanks.
Thank you. See you Wednesday. Thank you.
Hey, Dr. Gullett.